Welcome. Today we're covering high-yield hand infections for exams and clinical practice. Hand infections are common in orthopedics and emergency settings. If missed, they can lead to loss of function or even amputation. Early diagnosis is key. If you've been struggling to remember hand infections, then I advise you keep it simple. Start from the fingertip and move proximally. First, the finger pulp. Infection here gives you what is known as a felon. A felon is therefore described as a deep bacterial infection of the finger pulp. It causes severe throbbing pain and is a medical emergency requiring incision and drainage. In subsequent lectures, we shall deal with the exact incisions one makes to decompress these collections. Next, around the nail, we get a Paronychia or Eponychia. Paronychia is an infection around the nail fold. It typically presents with redness and swelling, eventually leading to pus collection that causes throbbing pain. Eponychia, on the other hand, is specifically an infection of the proximal nail fold. For this particular infection, look out for a red, swollen cuticle with visible pus at the base of the nail. Moving right along to the joint spaces. Infection in the joint spaces results in septic arthritis, be it that of interphalangeal joints or even that of metacarpophalangeal joints. Septic arthritis in the finger joints often results from puncture wounds, like a fight bite over the knuckle. This is a high-risk emergency with limited motion. This often requires an emergency arthrotomy. And then there are infections that happen in the flexor tendon sheath. This is what is often referred to as Flexor Tenosynovitis. Flexor Tenosynovitis is a surgical emergency. Always remember the Kanavel signs, namely finger in fixed flexion, fusiform swelling, tenderness on percussion of the flexor tendon sheath, and pain on passive extension. Now moving right along into the palm, we get web space abscesses, then Thenar and Hypothenar abscesses, followed by a deep palmar abscess. A web space abscess occurs between the fingers. It presents as a tender swollen area with pus collection, often appearing in the V between digits. A Thenar abscess involves the thumb compartment. This infection causes significant pain and swelling in the large muscle group at the base of the thumb. Similarly, a hypothenar abscess affects the little finger compartment. You'll see redness and a pus collection on the ulnar side of the palm. Deep infections, such as deep palmar abscesses, involve the potential spaces of the palm. These are serious conditions requiring urgent surgical evaluation. If an infection spreads along the bursae, you get a horseshoe abscess. A horseshoe abscess is a unique infection that spreads between the radial and ulnar bursae due to their anatomical connection at the wrist. And the most dangerous of them all is necrotizing fasciitis. Necrotizing fasciitis is a severe, rapidly spreading emergency. Look for pain out of proportion to the physical exam and visible skin necrosis. Core management principles include early diagnosis, IV antibiotics, surgical drainage when indicated, and proper elevation and immobilization of the hand. Early occupational therapy is important to prevent stiffness. So remember that a systematic approach makes it impossible to forget. It's simple. Start from the fingertip. Nail, joint, sheath, palm, spaces, fascia. And for your exams, remember, Kanavel signs for Flexor Tenosynovitis and pain out of proportion for necrotizing fasciitis. These are high-yield facts. Also remember that missed hand infections lead to loss of function. Subscribe for more orthopedic pearls to keep your clinical skills sharp. Thanks for watching. Hit the like button for notifications.